Peptic ulcer disease is like a sore in your stomach lining. Now, your stomach lining is lined with mucus. It protects your stomach and your upper intestine from damage by the harsh acidic environment. Now, the acid in your stomach is hydrochloric acid. It helps in digestion of food. Now, that acid is very corrosive, just like the corrosiveness of a battery. The corrosiveness of the acid in a battery, which is sulfuric acid, the pH is 1 to 3. So when you don't have good stomach lining, it will start damaging, the acid will start damaging the stomach wall itself. When you have that, it starts giving you symptoms like bloating. Bloating is when you feel fullness on your upper abdomen. That is due to gas. Then you have indigestion. Then you have epigastric pain, which is a hallmark of peptic ulcer disease, the hallmark symptom. So the epigastric pain is between your chest and your belly button. It pierces like a spear. They have things like nausea and vomiting, and when it gets complicated, you start vomiting blood. So why we are doing this video is we want you to know the triggers and how to avoid them, because when the peptic ulcer stays for long, it will perforate, and when it perforates, it's not a good thing. Your stomach will have a hole. So this is why we are doing this video. Now, the triggers are things like spicy foods, things like lime, things like beans, things like alcohol. These are the things that can trigger, and you need to also know your own triggers, because the triggers can be individual. You need to find out your own triggers and avoid it. And now, how do you treat it? You need to go to the hospital and see a doctor, because we have 3 ways of treating it. You have to kill the bacteria H. pylori, which you can acquire by poor hygiene, because it's fecal-oral transmission. You can get it from poorly washed vegetables, poorly cooked food, and you can get it from kissing. You can get it from hand to hand, because it's fecal-oral. Poor hygiene is how you get H. pylori. So you need to kill the bacteria. Then you need to take something that will coat the stomach and prevent more further damage. Then also you need to take something that will reduce the acidity of the stomach, that acid production of the stomach. So these are the things you need to do. There are so many herbal things you can try. We have cabbage juice. You can try cabbage juice. You can try ginger, which is an anti-inflammatory. Then you can try so many other things. Anything that works for you, you try it. I remain Dr. Nwichi Frederick. Investment in your health is your wisest decision.